Dear viewers, let us continue to our journey into pregnancy. I'm Dr. Olena Berezovska and welcoming you to my YouTube channel. It is important for any woman to understand the different periods of pregnancy because many decisions about diagnosis, treatment, carrying out or termination of pregnancy, and the course of childbirth are determined by the period and duration of pregnancy. Pregnancy is generally divided into 3 periods, trimesters. This is due to the peculiarities of fetal development, changes in the female body, and specific pregnancy complications and their causes. The first trimester lasts from conception to 12 weeks. Some doctors extend this period to 14 weeks. A child up to 12 weeks of age is called an embryo, and after 12 weeks and until birth, a fetus. The second trimester lasts from 12 to 28 weeks. The third trimester lasts from 28 weeks to delivery, 38-40 weeks. Most pregnancy losses occur in the first trimester, and this is due to natural selection. Nature itself rejects better fertile eggs and embryos. The closer to childbirth, the more complications that may occur on the part of the mother, while the number of complications on the part of the fetus decreases. In each trimester, several specific tests are performed to help determine whether the pregnancy is progressing normally. The first trimester is dangerous because numerous factors related to women's health and environmental conditions affect the formation of initial development of embryonic organs. Accordingly, during this period, hazard substances can disrupt embryonic development, and we will discuss it in another video. Most women do not know that they are pregnant until their periods are delayed, and sometimes even longer, because they do not pay attention to the delay. At this time, they drink alcohol, take medication, and smoke. The second trimester is usually the calmest period of pregnancy, also closer to 24-26 weeks. Some mothers experience health problems such as high blood pressure and blood sugar. I will tell you about hypertension and diabetes during pregnancy through other videos. The fetus grows to size where the structure of the organs and the systems can be seen. By 20 weeks of pregnancy, many fetal malformations, especially minor malformation, may not be detected. The longer the gestation period, the easier to diagnose fetal abnormalities. Usually, the sex of the child can be accurately determined after 24 weeks. At 28 weeks, the fetus is fully formed, and 90% of babies born at this time survive. The third trimester is when a woman's body is preparing for childbirth and when it's under the greatest stress. However, most of the women do not experience any problems. Between 90 and 90% of the children born during this period survive without any health complications. Some women and even doctors have a misconception that 7-month-olds survive better than 8-month-olds. The older the fetus, the better its chances of survival. Thus, 8-month-old babies survive in 90% of the cases. We discuss pregnancy complications that occur in different trimesters in another video. In obstetrics, there is a classical basis for the approach to pregnancy, unchanging knowledge, in fact, postulates that were formulated tens or hundreds of years ago. However, there are not many such stable statements. With the progress of science and medicine, views on the processes that occur in the female body during pregnancy have changed significantly. Many postulates have ceased to be postulates, and many old statements have proven to be false and even harmful. Thus, the niche of the classics is only shrinking against the growing niche of the modernity every year. Just as people no longer used cell phones from the 19th or computers from the 80s, many of the concepts used by doctors of the past no longer exist in modern obstetrics. Therefore, we discuss how organs and organ system change during pregnancy in other videos. Subscribe to my video channel, like and comment on the video. All the best. See you soon.